Hello and welcome to another edition of Health Matters. My name is Sherri Gallant and I'm with Alberta Health Services. In today's show, we have a great lineup of guests that will bring us some helpful information about a number of topics: tobacco use and how to stop, Seniors Week, and some great tips on how to keep seniors safe from falling and things like that, and also Safe Kids Week, which is coming up. So right off the top, I'm very pleased to introduce my first guest, Megan Burland. Megan is a health promotion facilitator. She's with the Population Health Promotion Program. And Megan, welcome. And why don't you just start us off by telling us all about World No Tobacco Day?
Sure. So World No Tobacco Day is celebrated yearly on May 31st. Basically, it's a chance for us to highlight the health risks associated with commercial tobacco use and advocate for effective policies and help people that are looking to cut down or quit tobacco use. And this year, the theme from the World Health Organization is Tobacco, a Threat to Our Environment. So this gives us a unique chance to inform people about the harms of the environment and how tobacco production can harm the environment, the massive amount of trees that are chopped down, the CO2 emissions, the billions of liters of water used. It's all quite substantial, and there's more information on the World Health Organization website. But it can be helpful to understand these impacts, and especially for youth when we're trying to motivate youth to refuse tobacco, to say no to tobacco. It can be quite motivating to understand these environmental impacts, and not to mention the litter that we all see every day.
That is really interesting to me. It's a connection I've never made in my head, and it is one more excellent reason to think about stopping. What would you tell someone who is thinking about quitting tobacco this spring?
Well, I think spring is a great time to start thinking about cutting down or quitting tobacco. The best advice I can give somebody is to plan ahead. So we know that research would suggest that our best chance at success is to combine some kind of behavioral support and pharmacotherapy, or what we call nicotine replacement therapy, or the two prescription medications. So now's the time to look into your options and kind of plan ahead for how you're going to address your quit attempt and to kind of, get all the pieces in place. In our group program, Quit Core, we do encourage participants to try different products and different quitting support techniques ahead of time to see what works for them. One of the things that we encourage people to do is to monitor their tobacco use for a few days or even a week, and write down every cigarette you have and the mood you're in and the need from 1 to 5 and the situation that you're in. And this gives you a chance to kind of look for trends, look for triggers. Like if first thing in the morning you notice that your need is a 5, and that's like a really triggering time for you, we're going to have to plan ahead for that time. So if you're used to kind of like waking up and having your cigarette first thing, you're going to want to try and start to break some of those associations and routines. So maybe for a short time, you want to try going for a walk first thing in the morning, or showering first thing in the morning, or sitting down for your coffee first thing in the morning, and then having your cigarette. And this can kind of break some of those routines that you might find yourself in, and start to break some of those triggers.
Okay, do you have any other tips for things that someone should include in that quit plan?
Yeah, so you're going to really want to reflect on things like your reasons for quitting. And we want to make sure that you're making these really personal and specific to you. So it's great to say that, you want to quit for your grandchildren, for instance, which is a reason that we hear a lot, but make it more specific. Add their name. What is it about quitting for your grandchildren that motivates you? Are you wanting to be able to play with them at the park without getting out of breath? Are you wanting to see them graduate? Do you want to be a good role model? You can even include like a photo on your list of reasons for quitting. And these can be really motivating if you find yourself in a time where you're having a really strong craving down the road. It can be really motivating to look back on this list. So yeah, make it specific, whatever your reasons are. And it can also help to pick a quit date. So we do encourage participants in our Quick Core program to pick a date. You can really pump yourself up for it. Some people even like to, clean their car, get all the tobacco smells out of their house ahead of their quit date, reward themselves a little bit for this hard work. And, maybe you're going to want to tell people that you're around a lot, that you're quitting smoking, remove some stressful situations from your day to day if you can, and just really plan ahead for that day.
You mentioned support. What kind of supports are available for folks?
Well, I think we're really lucky in Alberta. We have several options for free support. I mentioned our group program, Quick Core, and Quick Core is a 6-week group cessation program, and it's great because right now we're still mostly virtual. So we're using the Zoom platform, which means that in any one group, we can have participants join from all over Alberta, and it gives participants like a number of dates and times, days of the week to choose from. So hopefully you're able to find something that works for you. Each week we get into like a different topic. One week we talk about stress management. One week we talk about healthy living and nutrition. And it gives people a chance to support each other and tell their experience with quitting tobacco, and kind of, connect with people who are going through the same thing. So you can see all of our upcoming group dates on our website, www.albertaquits.ca. And basically that's sort of our group program. There's also a number of one-on-one options as well. So you can sign up for text support or telephone support as well. And to register for any of those, there's information on our website as well, or you can call the helpline at 1-866-710-7848.
So much there, and it always makes me happy to be able to tell people that those supports are available at no cost to them.
I
Thanks.
also recommend people talk to their doctor and pharmacist as well, about their pharmacotherapy options, the prescription medications, and really get prepared for success.
It just broadens that field of support. Thanks, Megan. As always, you are a fountain of information. Thanks for coming along and sharing all that with us today.
Thanks for having me.
Please stay with us. When we come back, we'll be talking about Seniors Week and some very helpful information on how to keep our seniors safe, or if you are a senior, keep yourself safe. Welcome back. Lisa Doyle is a health promotion facilitator with Alberta Health Services, and she is based in Medicine Hat. Lisa is going to talk with us about Seniors Week, which is fast approaching. Lisa, welcome. Thanks for being with us. And can you tell us a bit about Seniors Week and what you're going to be focusing on this year?
Absolutely. Thanks for having me. So Seniors Week is from June 6th to 12th this year. And the week focuses on celebrating and recognizing the contributions of older adults in our communities. So annually, organizations and community groups host events throughout the province, showing support locally. And for Seniors Week, we are focusing on healthy aging, and part of that includes falls prevention. So we know that among older adults, falls are the #1 reason for injury-related death, hospitalization, and ER visits in Canada. And falls can result in loss of independence, disability, chronic pain, fear of falling, which can lead to reduced activity levels, death, and is a large economic burden. The good news is that most falls are preventable, and there are steps people can take to reduce the risk of falling that support healthy aging to stay independent.
I know that with my own elderly mother, she's passed, but falling was a consistent issue that we dealt with her as she aged. You mentioned that there are steps people can take to reduce the risk. Can you share some tips?
Absolutely. So Finding Balance Alberta, which is a falls prevention program and awareness campaign run by the Injury Prevention Center at the University of Alberta, has developed evidence-based falls prevention messaging and strategies that older adults can use to help stay independent and prevent falls. Some of those messages do include keeping active, so building strength, challenging balance. We know that keeping active is an important part for overall healthy aging, but also focusing on challenging balance and strength has shown to reduce the risk of falling. As we know, those with stronger legs and good balance are less likely to fall. We also want to ensure that as we age, we have our vision checked annually. So in Alberta, adults 65 and older do have access to a free eye exam annually, so helping to reduce some of those barriers. Another important step is to have your medication reviewed by your pharmacist or your doctor. So there are certain medications that can put you at higher risk for a fall. And when you're at the pharmacy, take a moment to speak to your pharmacist about the medications you're on and any possible side effects. We also want to look at incorporating a healthy diet, which can help promote a healthy weight, prevent chronic diseases, provide essential nutrients and energy, and of course, help to maintain healthy muscle and bone density. And the Canadian Food Guide has some great recipes that support healthy aging available online. And also a reminder to stay hydrated as well. We also want to look at maintaining a safe home environment. So for example, ensuring your floors are clear of clutter and cords, removing any potential tripping hazards such as rugs, making sure your home is well lit, and adding grab bars as needed. And if you're not sure where to start, that is okay. Alberta Health Services actually has occupational therapists who are able to assist with environmental home assessments and modifications. And the last tip I'll share today is just ensuring we're taking care of our feet and choosing supportive footwear. So we're heading into summer here, and I know it's really easy to want to grab those flip-flops, those loose sandals, but those are ultimately going to be poor fitting. So choosing footwear that are well-fitted, supportive, and provide a non-slip tread are going to help prevent a fall.
You mentioned that keeping active and challenging strength and balance were a key strategy to prevent falls. I know that some people are sort of shut in, and maybe keeping active might sound like something they might not even know how to begin. Do you have some examples of how to incorporate more activity into someone's life?
Absolutely. So ultimately, it's really about finding things you enjoy, as you will more likely continue with it and see the benefits. So get connected with your local clubs and organizations to learn more about what opportunities exist in your community. And don't be afraid to try new things, whether it's pickleball, dance, walking, gardening, Tai Chi, yoga. Just really finding something you enjoy will help incorporate more activity. And if you're looking for more ways to include strength and balance into your routine, Finding Balance Alberta does have a variety of ready-to-use resources on their site. One is the Band Exercises for Older Adults booklet. The booklet does go through 9 different exercises you can do with exercise bands, which is a fantastic way to build strength throughout the entire body and is easy to use anywhere. You can also check out their warm-up poster, which goes through various warm-up movements that challenge your balance and also build strength. And there are a variety of exercise videos posted on their site that focus on balance and strength that are easy to use within your home. Of course, before starting any new exercise program, do check in with your healthcare provider beforehand. And for a full list of activity resources, you can visit findingbalancealberta.ca for more information.
Okay, where can people go to find out more information about Seniors Week? And I'm wondering if there's anything planned, any activities planned in the South Zone that you know of.
Yes, so individuals can connect with their local senior center for more information on events planned throughout the week. The town of Taber has been chosen to host the provincial Seniors Week launch and has a variety of events planned throughout the week. On June 6th, Taber will be hosting the Seniors Week launch at Confederation Park, which will include a full afternoon of exercise, dancing, and education. And individuals will be able to grab a resource bag, and there will be food vendors available on site. In Lethbridge, there will be a Live Well showcase on June 9th and 10th at the Lethbridge Senior Citizens Organization. And for anyone residing in Medicine Hat, the Viner Center will be holding a variety of events throughout the week. On June 7th, the Viner Center, along with Alberta Health Services and various community partners, will be holding an adult activity fair, giving individuals the opportunity to connect with local clubs, organizations, and at the event, people will get to register for free follow-up activities, hopefully finding something they enjoy and will essentially want to implement into their life. So lots of events happening throughout the week. And of course, check in with your local senior center for more up-to-date information on all the events planned.
That is awesome. Thanks so much for being with us today, Lisa. I hope you will stay with us at home, because when we come back, we're going to be talking about Safe Kids Week. Hello, welcome back. Thanks for staying with us. Safe Kids Week is May 30th to June 5th. Chloe Trautman is an AHS Health Promotion Facilitator in the South Zone in the Population Health Promotion Program. Chloe is also, and I'll just put this little plug in here, she's also a certified car seat technician. Chloe, welcome. I'm so glad that you're with us. Can you just jump right in and tell us what Safe Kids Week is all about?
Definitely. Thanks, Sherri. So Safe Kids Week is an annual awareness campaign, typically runs the first week of June. And so Alberta Health Services, Parachute Canada, Injury Prevention Center, and other community partners invite all Albertans to help raise awareness of child safety issues in Canada. So Safe Kids Week encourages public awareness and community involvement to be part of the solution. And the theme for this week for 2022 is active transportation. And the reason for that is around 5% of children and 1% of youth met the movement behavior guidelines in the pandemic. So these opportunities to be more active and to provide more safe and active transportation is so important now more than ever. And Parachute Canada describes their vision to make active transportation safe so that every child can walk, cycle, or wheel their way to school. So it encourages mental, physical, social, and emotional well-being.
I have to admit that until I saw the materials for this coming Safe Kids Week, I had never heard the term active transportation before. It was a new one for me. So that being the focus of Safe Kids Week this year, can you share some of the safety practices to help keep kids safe and active on their travels?
Yeah, definitely. So there are different safety tips to keep in mind, whether you're a driver, a pedestrian, or a cyclist, or other form of active transportation. So being a driver, it's important to reduce your speed. This gives you time to react and brake if needed. Keeping your distance is important, especially if cyclists are around, giving them more space on the road. And when parking on the street, always ensuring that you check before opening your car door for a cyclist. Putting your distractions down is always important. Being alert, just expect as a driver that kids will be kids, to be patient, so to be alert while you're driving, and then of course to drive sober. As a pedestrian, a few things to keep in mind when you're traveling with younger children. They still need time to develop their cognitive and physical skills to make safe judgments about crossing roads and traffic. So just be patient with them as well. Using sidewalks or paths, cross at designated crossings. So using the traffic signals and crosswalks when possible. And really important to be a role model as well. Children learn from their parents or caregivers, and over time, your frequent demonstrations will become ingrained in your child's approach to crossing roads. And as a cyclist, there's important things to keep in mind, and even other forms of transportation, like if you're using a scooter, skateboard, or rollerblading. So to ensure check your ride and be prepared, ensure their bike is adjusted correctly, the tires are inflated, brakes are checked and working, and knowing the bike rules of the road, and staying on the right side of the road to ensure that you're in line with the same direction of traffic, so that you're more visible to the drivers. Protecting your head and wearing a helmet and other gear if needed, depending on what type of transportation you're using. And with a helmet, using the 2v1 rule. And so if anyone is not familiar, it's when you're wearing a helmet, you put 2 fingers below the helmet above your eyebrow. A V makes around your ear, so the strap making a V, and then only 1 finger underneath the chin strap where it's buckled. So that's important to keep in mind. Again, that rule was 2v1. And then be seen and be heard is another important one. So wearing reflective clothing or having a working bell on a bike is also important to let folks know that you are on the road and so that they can hear you. So a few things to keep in mind depending on what type of transportation you're using.
You mentioned setting an example. Boy, that's so important. I see parents dropping kids off at school, like across the street, and their children are running across the street from the car, and I shake my head. But I'm wondering if you can talk about why it's so important to keep people reminded of these messages. What happens if we don't?
Yeah, and it's really unfortunate that every year about 1,078 children in Canada under the age of 15 are injured as pedestrians, and an additional 570 are injured as cyclists due to collisions with motor vehicles. So these messages really need to be driven home and bring that awareness to all Albertans to keep these injuries from happening.
That is really terrific information. During Safe Kids Week, do we know of any activities? Are there ways that people can participate?
Yes, there are. So one that Parachute Canada is encouraging is on June 1st to walk, bike, or wheel to school using an approach called Anything But a Car Day. And the acronym is ABCD, which is really fun. So some ideas to get kids excited about using active and safe transportation is to create an active school bus. So this is a group of children walking, biking, or wheeling, as I mentioned, with the supervision of more than 1 adult to and from a set location. Another idea is to create a school street, which is an activity that temporarily closes the street in front of the school to cars and opens it to allow students to walk, bike, or wheel from school. And there may be some other ideas that generate out there, but those are a few that could be implemented to use anything but a car.
Are there some specific things happening in our community, in our communities across the South Zone?
Yes, there are. So in Brooks on June 2nd from 2 to 6 p.m. at Veterans Park, there's going to be a farmer's market, and there will be a booth set up for bike and helmet safety. There will be bike registration forms as well and other information on active transportation. So if you're in that location, definitely check that out. In Lethbridge on June 1st as well, they're from 2 to 6 p.m. at Alpenland Ski and Cycle. And their back parking lot, there will be helmet fitting, free bike index QR stickers to register your bike, and other resources that are available as well. And Alpenland is actually providing a discount to purchase a new helmet for those who need one. So definitely check that out if that's something that you're in need of. And in Medicine Hat, there will be some bike rodeos as well. And check your media closer to June 1st, and they'll have some more details on where and what times as well. So lots of things will be happening. Those are only just a few. I'm sure there will be a lot more as well, and definitely visit Parachute Canada for more information on Safe Kids Week. There's lots of great resources and information on their website if this is a new week that you haven't celebrated before.
Thank you so much, Chloe. That's a wrap for this show. Parachute Canada is a fabulous resource. We hope people will go to that website, as well as ahs.ca, where there's a wealth of information on a million different topics. Thank you for being with us today. My thanks to my guests, Megan and Chloe and Lisa, and we hope you will join us again next time for AHS Health Matters on Shaw Community Link.